So, hello everyone. In today's class, we are going to talk about pathology of the gut. So, basically, in the GIT, we have four important organs. Okay, that is mostly esophagus, stomach, small intestine, and large intestine. All these are called GIT tract. Okay, other than we have accessory organs like liver, pancreas, spleen, gallbladder. We'll discuss in other classes. Here we will discuss only first mostly esophagus, stomach, bowel. Bowel is nothing but small intestine, large intestine. So first is X-ray. This is the X-ray. It is chest erect abdomen X-ray. What is called erect chest X-ray. So whenever a person have injury or abdominal cavity injury or any uh, mm, accident, traumatic injury, so we have to advise erect chest X-ray. So there are the chances of abdominal cavity injury. Okay, then the what happened? Then the and lungs air enter into the cavity and air is filled with that cavity. So to diagnosis the particular problem, we have to advise erect chest X-ray. And then the person will get the pneumoperitoneum. In the peritoneum, the air will be seen. Then- Okay, so first is perforation. Perforation is nothing but hole, space. Okay. In that the air enter, so it is the peritoneal cavity where air enter through that hole. Okay, mostly small stomach, bowel, etc. etc. Where anything will happen. Okay. So this is a mostly uh, bowel pneumoperitoneum. Okay. So for clarification, we need to do NCCT also. NCCT also need to do NCCT. So X-ray, uh, chest X-ray, chest erect X-ray is the recommendation for uh, any type of injury to the peritoneal cavity. Next pathological condition is that diverticulum. Okay, the esophagus diverticulum. This is the esophagus diverticulum. Esophagus is like this. Okay, easily the food will go inside, but in the esophagus diverticulum, what will happen? The muzzle will come to the anteriorly, okay, oh sorry, posteriorly the wall of esophagus. So it is called esophageal diverticulum. Esophageal diverticulum. So in that the patient have three main symptoms like dysphagia, difficulty in swallowing, regurgitation, whatever you will eat you will get outside. Okay, so these are the symptoms. You can see that. So mostly and these things, structural conditions need surgical intervention. So as gastroenterologist, surgical gastroenterologist will decide what to do here. Okay. Next images, all this way is okay. Next we have mm, hmm, this is nothing but gastroesophageal reflux disease. So mostly it is also related to esophagus. Esophagus. Okay. So in that the whatever we eat the food due to the excess amount of acid in the stomach region, so the food will enter into the esophagus. Even though the sphincter is there, so the sphincter also open and the food enter into the esophagus. So we'll call GERD. And another type of pathological condition which is related to esophagus, that is esophageal cancer. So all these are pathological conditions. You can see that this is the esophagus. In that, the cancer cells develop, the abnormal cell develop, they will multiply. Okay. First layer have been invaded, tumors are spread to the other organs and tissue that can't be removed. So all this happens. So uh, this is the uh, this is the metastasis condition. It will enter into the other organs, or go from esophagus to stomach, stomach to liver, liver to pancreas, pancreas to kidneys, like that. So this is the esophageal cancer. Next, we have, after that, esophageal cancer. Uh, in the baby, mostly this is the diaphragm. This is the upper above diaphragm, lower below diaphragm. So what will happen in some baby? What you have CDH. This is the congenital diaphragmatic hernia. So diaphragm completely not developed, or diaphragm had weak portion that due to the any injury it ruptured, and the internal organs enter into the upper cavity, chest cavity. Okay. So this is called congenital diaphragmatic hernia. Okay. So this is also a pathological findings. We have to remember this. Okay. All these are pathological findings. And other, so we discussed about GERD, esophageal cancer, and diverticulus, diverticulation of esophagus. Here also another diverticulation. This is called achalasia cardia. So in the achalasia cardia, so we have, in the esophagus we have two functions. One is in swallowing of liquid substance and swallowing of solid substance. In the esophageal cancer, mostly solid substance are difficult to swallow, and liquid substance easily you can swallow. But in the achalasia, okay, this is called functional dysphagia. Okay, here what happened? The whatever sphincter, it is not relaxed. Sphincter is here blocked. So that's the reason food is not entering. Okay, so mostly the liquid substance the patient is unable to swallow, difficulty in swallowing of liquid substance. Okay, so it is called functional dysphagia. In the cancer, structural dysphagia. Okay, patient is unable to swallow solid type of substances. In achalasia cardia, patient have difficulty in swallowing of liquid substances. So this is one of the pathology of esophagus. Next, here you can see that this is very important. This is called DES, means diffuse esophagus spasm, means the muscles contracted. Okay, whole muscle of the esophagus. It is smooth muscle, made up of smooth muscle. Okay, so that's the reason, any due to the any pathological issues, the muscles get into the spasm mode. Okay, so we call diffuse esophageal spasm. So it is also one of the pathological conditions of esophagus. Okay, so these are the important esophageal pathologies what we discussed. So all this will come in the reports. We have to understand what happened. If it is come eclasia cardia, means sphincter is unable to uh, unable to like this. Okay, unable to relax. Okay, so what happened? The patient will tell you that he is unable to drink liquid. If patient comes to you and tell, I am unable to take the solid food, liquid food I am easily able to take. Okay, so this will pathologies will tell you that what type of diseases are there. So diverticulation, esophageal uh, muscle will have a different place. Okay, and cancer, the different cells are developed, tumor cells or cancer cell developed their spasm. It enter the spasmodic mode. Okay, in the GRD. Okay, the relaxed. Okay, the sphincter is relaxed. So that's the reason food is entering into the esophagus, not relaxed. In GRD, sphincter is open. Here, sphincter is not open. Eclasia sphincter is not open. In GRD, sphincter is open, always open. So the food what we ate, it will come into the esophageal line. And congenital diaphragmatic hernia. So already I told you about that. So these are the important pathological findings of the esophagus. And already we discussed about pneumoperitoneum. So pneumoperitoneum is nothing but due to the rupture of cavity. Okay, cavity, air enter into the peritoneum. So there is a reason pneumo air peritoneal cavity. Air enter into the peritoneal cavity. So we have to do initially erect chest X-ray, and the best investigation of choice is NCCT. Okay. So this is all about esophageal pathologies. So we'll discuss how other stomach and bowel. So we'll discuss tomorrow. Anything regarding that you can ask.